Belatacept, also known as Nulojix Vial, is a medication used to prevent organ rejection in individuals who have undergone a kidney transplant. It is typically used in combination with other medications, such as mycophenolate and corticosteroids, to help the new kidney function properly. Belatacept is classified as an immunosuppressant, and it works by reducing the activity of the body's immune system to prevent rejection of the transplanted kidney. It is important to take Nulojix Vial as directed by your healthcare provider and to follow their instructions for the best results. This medication is usually administered by a healthcare professional in a medical setting. Before starting Belatacept, make sure to read the medication guide from your pharmacist. Your doctor may also require you to enroll in a special program from the manufacturer, Enlist Registry, before using this medication. If you have any questions, don't hesitate to ask your doctor or pharmacist. Belatacept is given by injection into a vein as directed by your doctor, usually over 30 minutes. After the first dose, this medication is given on a regular schedule as directed by your doctor, and the dosage is based on your weight. It's important not to increase your dose or use this drug more often or for longer than prescribed, as it won't improve your condition any faster and may increase the risk of serious side effects. If you are giving this medication to yourself at home, make sure to learn all preparation and usage instructions from your healthcare professional. Before using, check the product visually for particles or discoloration. If either is present, do not use the liquid, and learn how to store and discard medical supplies safely. Belatacept can increase your risk for serious infections, such as cytomegalovirus or pneumocystis. To help prevent these serious infections, your doctor may direct you to take other medications along with Belatacept. Make sure to ask your doctor for details. To get the most benefit from this medication, make sure to receive it regularly. Mark your calendar to keep track of when to receive the next dose. If you experience headache, nausea, or diarrhea while taking Nulojix Vial, it's important to let your doctor or pharmacist know. This medication is prescribed because the benefit to you is greater than the risk of side effects for most people. However, it can weaken your immune system, making you more susceptible to infections. Be sure to tell your doctor if you notice any signs of infection, such as cough, sore throat, fever, or chills. There is also a rare risk of developing a serious brain infection or certain types of cancer while using this drug. If you experience symptoms such as clumsiness, difficulty speaking, skin lesions, unexplained weight loss, or unusual tiredness, it's important to inform your doctor right away. While serious allergic reactions to Nulojix Vial are rare, it's crucial to seek medical help if you notice any symptoms of a severe allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so be sure to contact your healthcare provider if you notice any other effects not listed. And remember, if you have any concerns about the medication, don't hesitate to discuss them with your doctor. Nulojix Vial may increase the risk of developing serious infections or certain cancers after receiving a kidney transplant. It may also increase the risk of developing a medical condition called post-transplant lymphoproliferative disorder, PTLD, which can become a type of cancer. The risk is higher in people who have not previously been exposed to the Epstein-Barr virus. Before starting treatment with Nulojix Vial, your doctor should test you to check if you have had previous exposure to Epstein-Barr virus. This medication is not recommended for use to help prevent organ rejection after a liver transplant. Remember to follow your doctor's instructions for the best results. Before starting Nulojix Vial, make sure to inform your doctor or pharmacist if you have any allergies or if you are allergic to Belatacept. This medication may contain inactive ingredients that can cause allergic reactions. Be sure to talk to your pharmacist for more information. Before using this medication, it's important to discuss your medical history with your doctor or pharmacist. This includes any current, recent, or returning infections, as well as any history of cancer or immune system disorders. Belatacept can increase your risk of getting infections or make current infections worse. It's important to avoid contact with anyone who has an infection that could easily spread, such as chickenpox, COVID-19, measles, or the flu. If you have been exposed to an infection, be sure to talk to your doctor for more information. Before getting any immunizations or vaccinations, be sure to inform your healthcare professional that you are using Belatacept. Also, avoid contact with people who have recently received live vaccines, such as the flu vaccine inhaled through the nose. Since this medication may increase your risk of developing skin cancer, it's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and wear protective clothing when outdoors. Before undergoing any surgery, be sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or planning to become pregnant, be sure to inform your doctor. This medication should be used during pregnancy only when clearly needed, so be sure to discuss the risks and benefits with your doctor. It is not known if this medication passes into breast milk, so be sure to consult your doctor before breastfeeding. When taking Nulojix Vial, it's important to be aware of potential drug interactions that could affect how this medication works or increase the risk of serious side effects. This includes other drugs that weaken the immune system or increase the risk of infection, such as natalizumab and rituximab. It's crucial to keep a list of all the products you use and share it with your doctor and pharmacist to ensure the safe and effective use of Nulojix Vial. And as always, do not start, stop, or change the dosage of any medicines without your doctor's approval. If someone has taken too much Nulojix Vial and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. It is important to undergo lab and medical tests, such as kidney function and complete blood count, while using Nulojix Vial. Make sure to keep all medical and lab appointments and consult your doctor for more details. Make sure to take Nulojix Vial as prescribed by your doctor. If you happen to miss a dose, consult your doctor or pharmacist for a new dosing schedule. Do not take a double dose to make up for the missed one. It's important to follow the recommended dosage and timing to get the most benefit from this medication. Be sure to consult the product instructions and your pharmacist for storage details. It is important to keep all medications away from children and pets, so do not store Nulojix Vial in the bathroom. When it comes to discarding the product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard this product when it is expired or no longer needed, and you can consult your pharmacist or local waste disposal company for guidance on the best way to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.